Oh my gosh. What the heck is going on? Puppet people gone wild, alternative family planning, and what in the three-ring circus is going on? Today, we're breaking down and reacting to all of the risky business type of injuries and wild medical scenes from Sex Sent Me to the ER. All right, let's dive right in.
There is something going on between this couple.
Go ahead, then. Why don't you tell the nice lady what's wrong?
Can we move this along? This is a bit more than uncomfortable. Oh, so now you're speaking for yourself.
I don't know what I would do in this scenario if this actually happened to me. Really difficult to kind of take the situation seriously.
We call this condition paraphymosis.
Oh my gosh! Paraphymosis, which is going to explain, is basically when the foreskin of an uncircumcised individual has been pulled back, but swelling had occurred and you cannot get the foreskin back over the head of the penis. And the reason why it is a problem and an emergency, constriction around the glans penis will cause the head of the penis to swell, can actually decrease blood supply to the glans penis and turn into a big necrotic mess.
No!
If it goes untreated, the patient could lose the tip of his penis or more of his penis. Okay, that's enough. Hand over the dummies. Now, this is an ER, not a puppet show.
Good thing that the doctor stepped up and was just like, put all this stuff away, the shenanigans, and we need to just deal with the medical problem. Now, this does happen more than you think. I've had many patients come in with paraphymosis where you actually need to treat it and put the foreskin back where it belongs. Unfortunately, it's not the most comfortable scenario.
At the strip club, he got a lap dance. And it was during the lap dance that he first noticed this pain.
So when you have decreased blood flow to the tissue, ischemia could happen. Ischemia is basically when there's no oxygenated blood going to a tissue, which decreases oxygen to the tissue, which then increases the risk of death of cells, leading to necrosis or death of tissue.
Well, a lady came in with him. Clearly, she was either there for moral support or she felt some sense of responsibility for what had happened.
So I actually know this ER doctor, and he's actually a real doctor. He's not an actor.
So lift that ice pack up and let me take a look.
Careful, Doc. It's the only one I got.
I can't even bear to look at it.
And you are?
Rachel, the lover of my life.
Nice to meet you, Rachel. Well, Jack, one thing I can tell you for sure with a quick look is that you've got a fractured penis.
Oh, man.
A fractured penis is basically like a broken penis. We do not have a bone in our penis, but when we say that it's fractured, we're talking about the connective tissue that has now been snapped or ruptured, which then makes the penis itself not function the way that it should. So erections won't be normal, angles will be wrong, and it needs to be surgically repaired.
Do the surgery to fix this.
Right.
Surgery? Like with stitches
Oh my
and
gosh.
everything?
That the patient only cares about the stitches. You want your penis and your anatomy to work the way that it should. So this doctor is saying, hey, we need to get a urologist. So the ER doctor is there for pain management, making sure vital signs are all appropriate and resuscitate as needed. But the ultimate definitive care for this type of medical problem ends up being the urologist, who's a surgical specialist relating to genitalia, male and female.
Doctor,
Yes.
your patient has a visitor.
Who?
Well, she says she's his wife.
His wife.
Oh my gosh. That is a lot to handle in a short period of time in an emergency department, but things do happen like this.
God, it's so bent. Is it ever going to be straight again? Because if not, I can't see how we're
I
ever
need
gonna-
surgery, Jenny. It's serious.
Surgery? Oh, come on. Can't you just slap a splint on it and call it a day?
I mean, that is a good question. No, because the bone itself, say your forearm, if the bone breaks, you align it to allow the special cells to work to bind it back together. When it comes to a penis, the penis does not have a bone in it. It has connective tissue that needs to potentially be fixed, meaning if it ruptured, you need to go in there and re-sew it back together. You can't just approximate it and it'll refuse together. It doesn't work that way.
That's it. That's
Oh my gosh. What the heck is going on?
What did you do? I shut her up.
Give me some gauze right away. Here, come over here and sit down. Come over here and sit down.
Don't have much to say now, do ya?
Besides having a patient on the gurney, we now have another patient where this person probably got part of their tongue bitten off or lacerated. Tongues bleed a lot, and so it becomes quite complicated. Not every single hospital has an oral surgeon to be able to come down and help.
I've always had in the back of my head, it would be really neat to be able to have sex on the electric bowl. I mean, come on, what's more exciting than that, right?
I mean, I hope they own the place and that they sanitize everything after or replace it.
This is so hot.
It's slow, romantic, sensual, sexual, and then boom!
What happened?
I am getting electrocuted via vagina.
What? Oh my gosh. You can have electricity cause certain types of burns because it's heating the tissue up, per se.
Something horribly wrong happened.
Your entire pelvic region, including inside your vagina, is covered in burns.
What? The doctor's in a weird position. Appropriately, the patient's kind of gowned up and covered, and there is somebody at bedside to help and assist. Not every hospital or ER has the classic beds that you could put a patient in a position where there's stirrups, right? Sometimes we'll just have somebody in the bed with their feet like this. Sometimes it's easier to put your feet together and have the knees relax sideways so you can take a look at this area. If you're doing a full pelvic exam, the head should be down most likely just because it changes the anatomy position.
There wasn't really a whole lot they could do to treat my burns. They told me to do like cold compresses, no sexual activity for 2 weeks. I pretty much just had to heal.
So see, not much to do to treat the burn. So when you have a burn in general, you have multiple different categories of burns, and it has to do with the damage to the tissue. And that's good recommendation. A lot of the recommendation is based on like, hey, these are the things that you need to do, but you would want to do them anyway. You wouldn't want to engage in sexual activity if it's very painful.
Okay, so we're gonna run some blood tests, and then we're gonna do an ultrasound to figure out what's going on.
What's an ultrasound? Is it loud?
Is it necessary? She isn't really comfortable being in the ER to begin with.
Ultrasound is medical imaging that uses high-frequency sound waves to form images that we can look at organs and different structures in the body. It's used for some specific organs versus others are not, meaning a solid organ it's good for, a hollow organ isn't as good because it gets dispersed relating to air and gases.
The patient's mother pulls out a piece of chalk and draws a circle on the floor.
They're creating a sacred
What?
circle. They call us witches, but look at your sorcery.
Family members who use alternative therapy or means, that's okay. You just have to be careful, using it in the emergency department. They're using chalk, bringing things into the emergency department. You just want to make sure that it's safe for everybody else around because there's other people around.
Chew and swallow. Ma'am, please. At this point, I don't know what's wrong with the patient, and I've just about had it with this family.
Typically, when you're in the emergency department and you're having abdominal pain, you should not be eating food or drinking until we figure out what's going on. The reason why we do that and people don't like it is because you may have something that is surgical, but if you have ingested food or fluids, the anesthesiologist would not be comfortable with having surgery done, and then you have to wait 5 to 6 hours. So that's why we hold off.
Yes, you're gonna have to undress for this portion. I need to examine you from below. And all the tests that I've run are leading me to believe that there's no pregnancy, that there's something growing in there I need to take out.
Everybody's watching from below. Not normal. As a patient, you may ask everybody to get out of the room. And majority of the time, what we'd end up doing is actually turning the bed around if you're in this type of environment, just in case somebody tries to walk into a room by accident.
There's no pregnancy, that there's something growing in there I need to take out. Well, it's a vine, and I'm pretty sure I recognize a yam.
What? A yam, aka sweet potato?
Next thing I know, great-grandma's got a dagger, and she's coming after the fiancé.
The wedding has already been consummated.
And the grandmother is going on. The yams prevents babies.
Please do not put anything in your vagina. We're trying to prevent pregnancy by causing a blockage or blocking sperm from getting to the egg. Everything is quite microscopic at this level, so a sweet potato is not going to block it. This is so interesting. This is what I do for a living, and it is very accurate. So it's a good show. And if you guys enjoyed the show and you want me to do more, let me know. And if you want me to do other medical shows, please leave them in the comments below. And as always, make sure that you binge watch this playlist right here. Make sure you binge watch everything. And please subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.